Hi, today's July 27th, and we are here with this lovely couple. They're going to each state their first name and give Dr. Rutledge and CELOS permission to use their video on the internet. How you doing?
My name's Bob. This is
and I'm Angie.
Angie, now you guys are married and you both have had the surgery. Bob had it 7 days ago and Angie 7 weeks ago.
Right.
Angie, why don't you tell us how you found out about Dr. Rutledge and the Mini Gastric Bypass?
Actually, someone that we knew had had it with Dr. Rutledge and had great results. He had it about 2 years ago. And so we were looking at other options and decided to go with Dr. Rutledge after doing the research.
Okay, and then so you had the surgery and you watched her and said, I'm going to have that done too?
Well, we both were going to have it done. Well, obviously we couldn't have both done at the same time. We have kids and, of course, have a job and everything. So, you know, I tell everybody that, you know, I was going to see if she lived or not, and if she lived that. But no, seriously, it's just, this way it just worked out. It was just better for her to have it first. And of course, right, if we had had some problems, obviously I may have backed out a little bit. But obviously everything went well, and so that just encouraged me more to follow through.
Well, what was the last 7 weeks like for you watching her? Is it what you expected?
Well, I was just excited for her, and because you know, she was losing weight, and I knew that, you know, that's a good thing, and so it just, all it did was just I became more excited about having it done myself, because I was thinking, you know, if she's having this kind of results, I can be having the same kind of results, and we both, you know, needed to lose the weight.
And Angie, how did you feel the last 7 weeks?
Very good. I didn't have any problems with the surgery. Surgery went great. And I really haven't had any problems. I mean, everything has gone very well. So,
have you been able to eat everything you wanted?
not everything.
I'm
still, there's still some things that I can't eat, but I know by talking to other people over the long haul, it'll be fine, and I will be able to. It's just a matter of time.
You have to keep trying stuff over and over, because what is not good today can be wonderful tomorrow.
Right.
So what's your plans now? You're going to do your 1 month follow-up for us? Yes. And your 3 month follow-up, don't forget that. And how about your 6 month, and what comes after that?
A year.
1 year. Are you coming back to see us?
We'll see.
We'll see.
We'll see.
Make sure you're getting to see your doctor.
Yeah.
Now, I want to real quick ask you guys what kind of medications you were on before surgery. I know you're both on high blood pressure medication. And are you on it now, Angie?
No.
No.
No, my blood pressure.
And what's your blood pressure running now?
It's been normal, around 120 over 80, or maybe less. It just depends.
No medication?
No medication.
Wow. How about anything else that was a problem before surgery?
Really, overall, I just feel a lot better. You
Yeah.
know, I feel a lot better.
No swelling ankles, difficulty moving around, no
No.
backaches before surgery? No, well,
No, I didn't have any of that, but I just feel better. Just feel much
well,
better.
you look wonderful.
Thank you.
Okay, Bob, how about you? What kind of medications were you on before surgery?
Well, it was on the blood pressure medicine. It was I can't even think the name of it, because it was
X-Forge.
and then of course I was on Lipitor, but I have not taken my blood pressure medicine since the surgery, and I've been running about 130 to probably in the 70s.
Yeah, and even under 130, like it's 118. Yeah, it's been real.
So without the
great.
within 1 week. So, and I have
No medication. Just 1 week after surgery. Isn't that amazing?
And it's funny, you talk about the ankle swelling, even with the blood pressure, you know, post or pre-op, I struggle with my blood pressure. Taking the medicine, my ankles were always puffy.
Yeah.
And and within a couple of days after surgery, I mean, I had these skinny ankles. Compared, they may not look, but I mean, compared to what they were, and even Angie would just say, "I can't believe what your ankles look like." They look normal. They look normal.
Can't wait to get home and wear shorts, huh?
So, and like I say, I've lost. In 6 days, I've lost 12 pounds. So,
wonderful. And Angie, do you mind me asking how you're doing at 7 weeks?
I've lost 33 pounds.
33 pounds. That's amazing.
She had a real good week this week. She was getting a little concerned, because I guess the previous couple of weeks she hadn't lost much, but then this week, since we've been here, she's lost 7 pounds. So you get to 33 pounds.
Now, do you have the same primary care physician?
Mm-hmm.
And what does he think about all
We
this?
haven't been back yet. We have to go back when we.
I mean, I think she was glad for us. She both knew we were overweight and we had issues, and I think she was very supportive and glad we were doing this. So I'm just, when we do a follow up with her, and in a couple of weeks, and hopefully she'll go, wow,
And maybe she'll be able to recommend Dr. Rutledge to some other patients once she sees how well that we've done, because she was not familiar with him. But
or
anyway,
mini gastric bypass, but
no, she had had some
so
patients
well.
that had the regular gastric bypass, but
you mean the Roux-en-Y?
yes. But with the advantages of this one, then like I said, once she has some patients that have been successful, then hopefully she would recommend it to other patients as well.
So did you have a fast recovery like your husband?
Yeah, I did real well. I had no pain. I had nothing. The only thing I struggled with a little bit was being tired. Mm-hmm. And when I called, y'all said, take more salt, and you'll feel better. And that did help immediately.
So you got that down, Bob. When you're tired, you do what?
Take some salt. Yeah.
Okay, this is kind of a personal question. It's the last one I'm going to bother you with. What made you decide at this time in your life to go ahead and have gastric bypass surgery? I mean, why not 5 years ago or
Well, I mean, for me, it was just I had put on a lot of weight this year. And you just when you're over 300 pounds, almost 350 pounds, you don't look good, you don't feel good, you don't feel good about yourself. And it seemed like, even when I try to cut back my eating, do a little, it just seemed like it wasn't working. And with my blood pressure issues, and I'm thinking, I'm cutting my life short, and I still got 2 teenage boys, and and I hope to live, much longer and could see them grow up and have kids. And I'm thinking, at the rate that I'm going now, that's in doubt, and it pushes the quality of life, and I was tired all the time, and it's something we've been discussing for a while,
because you saw like commercials or TV shows,
well, just and we had known some people who'd had the weight loss surgery, and
how'd they do?
One lady I knew lost a lot of weight, but then she gained it all back. So, but I was thinking, if I could just lose it,
you could keep it off.
Hopefully I could do better than she did. So we researched the stuff, there in Houston, and the lap band, and the other types of surgery you could have, and then, like I say, then we came with this man that we knew. We came across him, and you couldn't even recognize he had lost so much weight, and found out. That's how we found out about Dr. Rutledge. And
he decided to come across the country.
And so we did the research, obviously, and decided this was the best choice for us.
Well, you both look wonderful, and I look forward to hearing great success from you both. Thank you very much.
Thank you.